Hi, this is Sally Morgan, craniosacral therapist, physical therapist, and Tellington T-Touch practitioner for animals and people. Now we're all sliding off the chair, not just Tristan. And this is Tristan. He's a Corgi. He's wearing his tie today. See his tie? And this is an episode of Conversations with a Corgi. And today we're going to continue our discussion about fascia and ways to work with fascia to bring about healing and improve function. So today we're going to talk about the most obvious way to treat fascia is with the myofascial release techniques. Myo means muscle, fascial is fascia, and so to release the muscles and the fascia around them is myofascial release. And there are a couple of different places that teach this work. One of the better known ones is the work of John Barnes, and he has many classes still running, and he has a couple of locations in Philly and Sedona, I think, where they hold classes, and many levels of classes, and at the highest levels of his work, as with many kinds of fascial and lymphatic and other work, you're actually working on the tissues in the brain, which really can make huge, profound changes for you or your pet or your horse when you're receiving myofascial work. Myofascial work is something that a lot of massage therapists, chiropractors, physical therapists, occupational therapists have additional training in besides their training in their specialty. My house is cracking and cracking. I think it's warming up a little bit outside, but boy, the windows and the wood, just sounds like the house is 100 years old, not 7. Anyway, it's making Tristan nervous. So, another place that teaches myofascial release is the International Alliance of Healthcare Practitioners, which is part of or adjacent to the Upledger Institute. They have a class in myofascial work, which I have taken, and there are several others available if you look online. One of the hallmarks of these types of myofascial work is that we use what I talked about earlier, the triplanar release. So you have your tissue between your hands. The bottom hand is pretty stationary. The top hand gently sinks into the tissue, and then you follow it. You test it right, left, and it wants to go right more than left, so I go that way. And I hold it, and I hold it until it stops moving, and then I test it front to back. It wants to go towards me, so I keep going that way. Notice what's happening to the fascia while I'm doing this. It's getting flatter, so it's releasing itself. And then you add that third part of the triplanar technique, which is the rotational component, and you might have to move your bottom hand slightly to stabilize the tissue as you put in the rotational component. And now I have set up a fulcrum, and I just hold that and hold it and hold it and hold it until I feel the tissue starting to move. Then I follow it and hold it and hold it and hold it. And for instance, I was working with a dog with a neck issue a few weeks ago, and I did this technique deeper and deeper into C1-2OA area for about 45 minutes because she had so many restrictions there. So this is not a quick technique, although it is deeply effective, and one technique or one session can often make profound permanent changes. So you just hold this until it releases fully, and then when you're done, your hands will be kind of pushed away and you've got this springy, happy fascia again. So with that dog, she had had repeated injuries to her neck, and so following the fascia in, I was getting releases at layers and layers of injury. So she might still have some more deeper layers of injury in there, but I just continued to follow what I had during that session until I felt that she had had enough. And usually you feel what they call a repelling sign, like your hands being pushed away. And then there are many tissue release signs that people talk about in everything from horse whispering to massage to cranial work. And those are things like taking a deep breath, licking, chewing, sounds of the stomach grumbling, relaxation, releasing of gas, all kinds of things that your body does when it's relaxing. And those are tissue release signs. I think Tristan, yeah, you're a good boy. His stomach is growling right now as we're discussing it. He's digesting his breakfast in there. He's a little chubby. We've got to cut back your dinners, Biss. So that is one thing that you can do. And there are many, many people that do myofascial work. As I said, many massage therapists are trained in this area, and it's really effective for things like overuse injuries or incorrect use of muscular injuries. Like, because of my broken collarbones, I use all kinds of neck and shoulder muscles the wrong way because they're compensating for other muscles. And so I constantly have restrictions in my upper quadrant, as we call from here up. And so myofascial work, which I can even do on myself with one hand, is really effective to release that trauma. And many people that do myofascial work do many other modalities as well. I don't know many people that do myofascial that only do myofascial work, because you're trained in so many other layers of skills along the way, that you're not strictly just doing that. And there are many whole body techniques to assess where your body needs work. And so a person may check you or your dog and see where you have some restrictions, and the myofascial work may be a part of what they're doing. And of course, we're releasing the muscles and the fascia, and that is really effective because you have to hold the release for a very long time. And remember, when we were talking about fascia, we were talking about holding it for a long time with a light pressure. So these techniques are what we consider non-invasive, indirect, not too traumatic to the body or the person receiving them. They're usually very relaxing techniques, and you may feel a moment, like I had a lady who was in a car accident and the car had rolled several times, and as we got her body all lined up as we were waiting for the releases to happen, there was that moment when things were perfectly aligned, when she'd have like a flash of the pain and trauma of the accident. But as soon as my hands met that fulcrum and things started to shift, it would pass. And that is really typical. And that's why doing these techniques with an animal, it's really important that even if you're not trained specifically to work on animals, that you are very familiar with that particular animal's behavior, because many a horse has done a quick bite or kick at the moment you get up into that trauma when you're doing the myofascial work on like a stifle or a back injury or a neck injury or a jaw issue. And so it's really important that you know how horses respond, or dogs. Dogs can, the one dog that I know who had a lot of surgery in the limbs on one side of his body with a lot of replacement joints and bones, he had a lot of pain, and he was in surgery for a very long time. He was a very big dog, so he had a lot of weight on those joints, and frequently he'd be snoring, sound asleep, taking deep breaths, and turn around and just like practically in his sleep snap at the air and go right back to sleep as we were doing the release work throughout his body. So it's really important you're familiar with animals if you're going to do this work with animals. And there are a few places that teach this work specifically for animals. And many of the animal massage programs do teach you a little bit about myofascial release. So it's not extremely difficult to find someone to do this for your dog or your horse. Horses might need this more than dogs, although if you're competing in field trials or agility or rally or dog dancing or even nose work, if your dog has to be really high functioning and using his muscles in ways that are not his typical, laying around the house and taking a little walk kind of a way, your dog could sustain some injuries where myofascial release could be really helpful. For horses, this is an important part of their care, and there are many people that do myofascial release work with horses, and it really can help relieve some of that. Remember, we talked about the fibers needing to be lined up in the direction they go. And so many horses get kicked in the pasture, up in their haunches, and the fibers there are running kind of longward and down. And where there's a kick, it gets like a little bunch in it. And so it's really important to get that myofascial work to allow that bunch to release and straighten out and align with the fibers so that that horse doesn't become chronically lame or a little bit off or not stepping up fully on that side where he had the kick, and so he can resume full function. If that is not addressed specifically, then you may get a horse with a chronic short step on that side, it may only be an inch, but that's enough to throw off the balance in his sacrum and his spine and his whole hindquarters, so that you develop a horse that has issues with other training and behavior problems come along because he's chronically in pain and not in balance. And the same is true for our dogs. It may not be as obvious with them because we aren't riding them and we aren't asking them to use their bodies always at the highest level that we ask horses to perform. But even somebody that does a lot of hiking with their dog, certainly in New England, we have many people that walk 2 to 5 miles with their dogs on trails on the weekends and in deep snow. And a dog can kind of do a split in the snow and develop a fascial injury up in the top part of his hind leg or up in his shoulder, and really be benefited by some myofascial release work to maintain that function and mobility in the areas that were affected by the injury. So that's another way to release fascia. We talked first about craniosacral therapy, where you follow the tissue in and then again get to a place where you feel it stop moving and hold it and hold it and hold it. And it's so important to remember that this is a light pressure held for a long time. And we create this fulcrum, which is like that idea of the old telephone cords that used to get tangled, and you hold them and let them unravel and spin until they were straight again. And that's basically what you're doing with the fascia. You're holding it stable so that it can unwind and reorganize under your hands back to a more functional pattern. So, anything else, Biss? That's what we're going to say about myofascial release today. We have several other techniques to talk about for fascial release, and we will continue with those Thursday, Friday, Saturday, Sunday. Wednesday, I'm technically at my job as an educator, but we're having a huge snowstorm, so it's not starting till about the time we're supposed to be at work. So I'm guessing I will still be at work. So I'm not thinking we'll be doing conversations with a Corgi tomorrow, but you never know. So we will see you then. Everybody have a great day. Stay warm where you are. The storm that's coming here is just creating havoc across Kansas and Iowa and Ohio. It's really something. Weather. And my stream, I don't think you can see it from where you are because it's so white behind me, but the stream is up really high, and I was getting a little nervous, and then I realized, you know what, it's not much higher than it was when the beavers were living there and we had a heavy rainstorm. So I'm not really in a panic because the land there is made for chronic flooding and not flooding, and it is about, well, first of all, it's like 100 feet, 200 feet from the house to where the hill is, and then the hill is about 15 feet. So we're not getting any water in here except from the rain dripping into this little area in my basement, but otherwise we're doing well. So got a really busy day today, and I will see you guys again on Thursday, where we will look at another method to release fascia. Cute in your tie, Biss. Very cute in your tie. Show everybody your tie. There's his tie. He's ready for a day at the office. Whoops. Thanks for joining us. Stay warm, everybody. We'll see you in a couple days.